Quick question, are all those things absolute and happening right now?
Yes.
So anyone, no matter who your carrier is, would have 100% of their preventive care
Yes.
covered?
So effective January 1st, there are a whole host of preventive care items that are now included at no cost share to the participant. They added 15 adult preventative systems. They added 22 women and 26 child care preventive provisions that will all be covered at no cost. Okay.
So every policy pays for children and factors in children, and like if I took a single policy,
Right.
you know, I don't need children.
You don't need to cover your children to age 26, but you wouldn't.
So that's not built into it.
If you had a group contract, if you have a group contract, your group contract would provide that any member that has a dependent under the age of 26, that member can join the group plan. But you buying an individual plan, it really doesn't pertain.
The adult insurance can no longer differentiate between men and women.
Correct. I'm going to get to that a little later. We're going to talk about the community rating and what's happened there. So going back to the objectives, the next objective was to lower the uninsured rate. Okay, and again, going back to the uninsured in this country are unemployed, low-income children. So what they did is they did it via two means: encouraging participation, all right, via penalties, or reducing the barriers to participation by imposing some of these provisions. So let's talk about encouraging participation. We've got the individual mandate, which says effective January 1st, now extended to March 31st, all individuals, every single consumer, anybody living in the United States must have insurance somehow, some way. If you don't, we are going to impose a penalty on you. The second is the pay or play, which is for larger groups, those groups that have 50 or more full-time equivalents. There will be a penalty if you don't provide insurance for your employees. So this is their means of trying to get participation and cooperation. The other way is by reducing barriers to participation. They increased access by creating the exchanges. Okay, it wasn't easy for you as an individual to get access previously. You had to go find a broker, you had to go on the internet yourself. With the exchanges, and we'll talk about all the metallic levels, they've designed it in such a way to make it easier for individuals to obtain insurance. Subsidies for individuals and credits for businesses, again in here, trying to help reduce the barriers to participation. Removal of the pre-existing, that was a barrier previously, no longer a barrier. Everyone is entitled to get insurance regardless of their current condition. Any questions on that? Sure.
So if someone was unemployed, had no job, and they couldn't afford insurance, the government's going to penalize that.
There are some exceptions, and I'm going to get to the individual mandate in another slide or two. There are some exceptions to the individual mandate, such that if your income is below that where you're required to file a tax return, you are not penalized. So the unemployed, and they look at household income, so very often you have one unemployed spouse and you have another that has a job, therefore the family is expected to get coverage because they'll look at their income together. Reducing the cost of health care, and here we're talking about reducing the cost of health care to the consumer. What they have done is they've put limitations on the deductible and they've put limitations on the out-of-pocket. So no plan can have a deductible greater than $2,000 for the individual or $4,000 for the family. And no one contract can have an out-of-pocket maximum more than the $6,350 for an individual or $12,700.
Is that true whether it's an individual plan or a group plan?
Yes.
I just got quoted on a 1020 maximum out of pocket. Literally, just
10,000.
Several individual programs that have $10,000 and $20,000 worth of maximum out of pockets. I mean, obviously somebody doesn't. Somebody's doing something. I'm not.
Okay, well let me look into that for you, Ken. I mean, if they're on the exchange, they're valid and they've been approved as qualified health plans. So maybe this is just a group rule. Let me investigate that for you. And one thing I want to say is, this has all been evolving so quickly. So everybody's got questions, and truthfully, nobody has the answers. So when somebody asks a question, the answer is typically, I don't know, it depends, or we're waiting on guidance, or we're looking for clarity. So I'll do my best to answer your questions. Maybe this is just a group limit. Preventive services without cost share. I mean, we were talking about it previously, but the intent is if we let everybody have access to preventive services, if we get everybody insured and then they have access to preventive services, ultimately people are going to become more healthy. This is something every time I do a group enrollment, I talk to the group about. Everybody should be taking advantage of the fact that you can get preventive services at no cost. And ultimately, if you take care of yourself at a younger age, you avoid the ultimate and costly of early onset disease or other costly medical expenses that occur because you haven't taken care of yourself. So this really is designed to encourage the consumer base to go take care of themselves, go out there and take advantage. And with the expansion of what is considered preventative, there's a whole host of other services that everybody can take advantage of. So you've got immunizations, screenings. The women's preventive is now pretty wide. Men's health, pediatric dental, that was a little thing that they snuck in there. Actually, I'm going to hold that off till we get to essential health benefits. Improve healthcare quality. Now, you've probably all heard about the taxes and fees that are now going to be included or part of your premium driver. And that's the negative of this, that we are all seeing increased premiums, this being one of the drivers. But the fees and taxes are really for the government to do two things. A, to help them with the subsidy for the low income in getting those subsidies, and also to fund research for better medical outcomes. The money that's being collected specifically, and there's different taxes and fees, there's fees that are specifically being collected for this purpose. All of that money is to go into research into health outcomes, comparing alternative treatments, looking at alternatives of medical treatments, and assessing the risks and benefits to various treatments. Ultimately, this is stuff that takes a long time to filter through the system. But if you're doing the research, we now have the data capabilities to take and mine a lot of data to understand what's happening. With those capabilities and the collection of the data, hopefully we're going to understand what treatments work, what treatments don't work, and kind of get that back into the system and how doctors actually treat us. So the individual mandate we had mentioned earlier was to help everybody to lower the uninsured rate. I'm assuming that most of you have heard this. Everybody's required to have the insurance, and if they don't buy insurance, they are charged a penalty. The penalty is charged at the time you file your tax return. This year, it's not significant. It's $95 per adult, and half of that per dependent that doesn't have insurance. And as I said, there are certain groups that are excluded from the penalty. If your income is so low that you don't have to file a tax return, then you're excluded from the penalty. There's certain religious sects, Indian tribes, most of those not pertaining. The penalty does go up.
For what reason did they eliminate those certain groups? Do they not get sick?
Probably they had a pretty strong lobby down in Washington.
If you're a Christian Scientist, for example, and you don't believe in medical treatment, why would you require medical insurance?
Suppose you
So-
were a Catholic and you didn't believe in contraception.
No,
why would that?
The issue is whether you get insurance or not.
Okay.